Hello and welcome to this very special edition of the Living Well Health Show here on Metro TV. I am Sandra Ofosu Dewolu. I am bringing you this very important conversation with a very august personality. I will tell you why and who this personality is. We'll go for a quick commercial break. We'll be right back.
As I stand here, there's a lot of disease killing each and everyone in our society. There are disease transferred from others, and there are disease too that cannot be transformed from others. And we need the government to come around and show how to treat ourselves so we can live a good, healthy life.
I don't know anything about that, but if the government can do something about it, then for sure they should do something.
I think it would be important for the government to create the awareness for the general public to know about non-communicable diseases. I think that even those of us in the cities don't really have a lot of idea about it. So it is important if, through social media platforms, through the Ministry of Health, can create such awareness for the general public to be aware and have some preventive measures that also can be put in place. Will be a very good deal.
Professor Peter Lante is a distinguished scientist and President Emeritus at FHI 360. He is a professor in Global Non-Communicable Diseases (NCDs) at the London School of Hygiene and Tropical Medicine. He is an internationally recognized public health physician and expert in developing countries. With a career at FHI 360 spanning more than 30 years, Professor Peter Lante has been instrumental in establishing FHI 360 as one of the world's leading international non-governmental organizations in implementing HIV/AIDS prevention, care, treatment, and support programs. His experience in HIV/AIDS efforts internationally includes collaboration with the World Bank to design and monitor the China Health 9 HIV/AIDS project. From 1987 to 2007, he directed multiple USAID-funded HIV/AIDS projects in over 65 countries in Africa, Asia, Latin America, the Caribbean, Eastern Europe, and the Middle East.
Welcome back. So for today, our very important personality we are having this conversation with is a physician by profession, and he is also a professor in non-communicable diseases. We are privileged to have on this show Professor Peter Lante. Hello, Prof.
Hello.
It is very good to be here.
I'm delighted to be here as well.
Thank you very much. We've heard so much about you. We've seen some lectures you have conducted recently. There was the Joseph S. Ejapon lecture where you were the distinguished guest speaker. And the topic had something to do with non-communicable diseases and the greatest challenge in Africa.
Yes, it was. And the topic of non-communicable diseases are an extremely important topic, especially in Africa, because in the past we have been used to what we call communicable diseases, diseases like measles, like typhoid, and more recently HIV and others.
Right.
But the one of the most important areas is the non-communicable diseases. Right. And these are diseases that are normally not spread through contact with somebody else.
Okay.
But they are diseases that are usually due to our behaviors.
Okay.
They're usually due to what we eat, what
Okay.
we drink, what we smoke. And these have become the most important causes of both ill health as well as mortality in Africa.
Right.
And it is, we estimate actually that 80% of all deaths in globally are
Right.
due to non-communicable diseases.
80%, you said?
80%.
Wow, that is a
Yes.
large number.
It is a large number, and also non-communicable diseases, a large group of diseases that related to heart, also the cardiac aspect. Then we have diseases like cancers, and the whole slew of them that also can lead to ill health as well as to death. Then we have other diseases that we'll go through as we go. But the most common by far are cardiovascular diseases and cancers. And those are the two largest groups of non-communicable diseases that are currently affecting Africa.
Right. Is that the order? It's first cardiovascular and then cancers?
Yes, cardiovascular diseases account for roughly close to 20 million deaths a year, and then they are followed by cancers.
Right.
But the cardiovascular diseases that we see, high blood pressure is one of the components of cardiovascular diseases.
Right.
Extremely common and causes not only ill health, but can also lead to morbidity in terms of strokes, but also can lead to death. Okay.
Right.
Then the second largest group will be cancers, and there are lots of different types of cancer, whether it's cancer of the breast in women, cancer of the uterus as well in women, as well as cancer of the lungs, and a variety of other cancers that can also affect both men and women. So these diseases, unfortunately, are very difficult to cure and very difficult to prevent in populations.
Right.
However, there are things that we can do, not only to minimize the impact of these diseases in terms of prevention, and the examples will be, for example, the way we behave, what we eat. We have to cut down smoking or eliminate smoking altogether. We also have to make sure that we don't drink alcohol excessively. All these are potential inputs, and one of the most important that is becoming more important, especially in both urban and rural populations, is lack of exercise. So the four elements, preventable aspects of cardiovascular disease are eating habits, no smoking, better exercise, and better healthcare.
Better healthcare.
Yeah.
Prof, let's go back a little bit to the eating habits.
Yep.
Let me start from the eating habits. From a part of the world where we are, where we have a lot of carbohydrate-based meals. You can get the carbo in our banku, you can get the carbohydrates in our fufu, and we love our banku and our fufu.
Yes.
What would be the simplest trick?
Well, I wouldn't even call it a trick. I would say the problem is that, or the challenge that we have is that we are eating the wrong type of foods. We are eating them in excess. And if even the right type of foods, we also tend to eat the very worst part of it. We all need a balanced diet. And you've heard that numerous times. It has to be the carbohydrate or the starch component that you mentioned. It has to be balanced with protein. There will be some fat. There should be some vitamins that you get from your food and others. So the balance, unfortunately what is happening is that if you tend to eat too much of carbohydrates and fats, you put on too much weight. If you happen to smoke, that increases your chances of lung disease as well as cancer of the lungs. And if you are diabetic and your diet has even to be even more stringent. So these are behaviors that we need to look at very carefully. But overall, we are talking of the general population
Right.
of people who start as being healthy.
Right.
Okay. And gradually they develop these bad habits. One of those bad habits is put on a lot of weight. Okay. Unfortunately, in our culture in the past, we've always thought that gaining weight is a good thing, and is portrayed as being wealthy, both men and women.
You are living well.
You are living well. I'm sure you've heard that expression many times.
Right.
Your husband is treating you well, or your wife is treating you well.
Yes.
Okay, that has to change.
Right.
The body has a limit with which it can function normally without any complications, and we all have to be within that ideal weight. When you put on too much weight, then you change the balance, and you increase the potential of getting a variety of diseases and premature mortality or dying too early.
Right. Why should non-communicable diseases be of public concern?
Well, just as I said earlier, for a long time, most developing countries, including Ghana and the rest of Africa, we had a communicable diseases. Diseases can be spread easily from one person to the other. And those are the ones that we focused on. Over the years, and I'll give an example. I mean, if you go back in developing countries to about 70, 100 years ago, we were dying mostly of communicable diseases. Now, this pattern has changed drastically in the last 50 to 70 years. Now we are likely to die of the excesses of the what you eat and how we behave. So we are getting the diseases of the wealthy without the wealth. Yes, we are at the same stage as developed countries, industrialized countries, in terms of the diseases that they are also getting. But we have a fraction of the wealth that is needed, not only by individuals, but also to make their lives more healthy. And that's the challenge that we face now.
Why should that challenge exist?
Well, it exists for a variety of reasons. One is that we got more wealthy. We can afford different types of foods, a lot of which are unhealthy. That's the first thing. We've acquired the habits of smoking, which for a long time, it wasn't a major problem. We are acquiring the habits of eating excessively and the wrong type of foods. Fast foods. Those are some of the foods that we should avoid.
We love our pizza.
We love our pizza. We love our
French fries.
French fries, hamburgers. All these foods are the ones that are likely to get you to gain weight. And they're also not adequately balanced. Okay, so eating habits is one important element. The second, the smoking habits have gone up dramatically. And people think it's cool. Young people growing up think it's cool to do those things. We also are exercising less. Partly because of industrialization. The fact that you have to go to work, you have to take some form of transport, get there, you close late, and then you come home, and then you don't have the opportunity.
The traffic situation, Prof.
Yes. Unfortunately, that's one of the complications of the so-called industrialization.
So, Prof, my parents are in the eastern region.
Yes.
Koforidua, to be precise. And it takes me an hour and a half's drive from Koforidua to Adenta Barrier. Then, Prof, can you believe that it will take me an extra 2 hours from Adenta Barrier to my office at North Ridge? Traffic.
Yes, that I can completely understand. Unfortunately, it's one of the complications of rapid industrialization. We are getting modern transport to get to us we are, but too many people have got it, and the road systems are not adequate to address this. So, and that's what leads to one of the complications. If you have to spend 2 to 3 hours in traffic to go to work, and possibly same thing to come home. You don't have any free time to do either to cook properly, cook the right meals. You don't have enough free time to be able to exercise. So you eat, you go to bed, and then the cycle continues. So it's the urbanization, that is the urbanization of large sections of the country that is leading to, yes, you are more affluent and you have a car, but this unfortunately makes it more difficult for people to follow normal practices that will keep them healthy.
Right. So, Prof, you mentioned the top two most severe or current non-communicable diseases as cardiovascular and cancers. What would be the third, fourth, and fifth?
The third, fourth, diabetes is an important one. We also have a lot of mental health disorders. That are also extremely important. And all these contribute to this large group of diseases that we call non-communicable disease. They are very different in their origins, however, the end point or the end result of having all these diseases are the same. Premature mortality, people dying too early, chronic disease where you are ill for a long period of time, and eventually incapacitation. But one of the most important elements is that most of these chronic disease cause so much ill health, people can't afford to work anymore. Therefore, they lose their income, and it creates a vicious cycle of living in those conditions and living, getting close to poverty and not be able to afford even the things that they need to do. So the discussions that we had at the 75th anniversary of University of Ghana yesterday was trying to, this was addressed not only by my lecture, but a lot of the healthcare professionals who were there, who were discussing some of the issues and the challenges that they are facing in the country to be able to. But this is not an issue that Ghana only faces. All of Africa, as well as most countries. But one of the things that I'm also going to mention, and this is how we measure the overall impact of these non-communicable diseases, is that lifespan, the average lifespan of somebody in Ghana or in Africa in general, 100 years ago was around 25, maximum 30, or 200 years ago, sorry, was around that low because a lot of babies were dying early, and adults also were dying early. The same thing applied to Europe as well. But over the last 150 years, Europe has gone from a life expectancy in the 25, 30s to now a life expectancy of 75, 80. Africa has also improved. It's improved to around 60 plus. And when I say that people on the average in Africa are living to 60, it doesn't mean that everybody's going to die at 60. All it means is that a lot of young children are dying early, and some live, of course, much longer. But the main challenge is that the average is lowered because of a lot of people dying young, and a lot of adults also not living to their full potential in terms of life. So we are still behind the industrialized countries in terms of how much we can get out of our life on Earth and how much longer we can live. And the bottom line, all this impact is impacted by what we are talking about, combination of non-communicable diseases, as well as that of the infectious diseases that are also, unfortunately, highly prevalent in our cultures. So that's the challenge. We have the diseases of the poor, and we have the diseases of the rich.
All in an underdeveloped or still developing country. What should the individual, first from the individual level to the country level, what should players do?
Yes, actually that's an important question. At the individual level, we need to provide enough information, incentives, to make people want to change their behavior.
Okay.
And we know the behaviors that put them at risk. We know the behavior that put them at risk of getting communicable diseases as well as non-communicable diseases. We also have to get them to change their eating habits, okay? Improve upon them, eat the right type of foods, eat less of the foods that are tasty but are not good for us, okay? And then third element is to know what things to do for their health.
Right.
Okay. Most of the non-communicable diseases, you don't get symptoms in the early stages.
Okay.
So the only way you know you have hypertension, for example, is having your blood pressure checked periodically. Okay. That's the only time that you know you have hypertension. Unfortunately, some have it for so long without knowing that the first sign will be a stroke. Okay. When that happens, it's too late in the game.
Right.
So teaching people to take care of their own health, check your weight, their blood pressure, and all the other aspects of their health. It's easier to intervene when it's early, when you diagnose blood pressure, hypertension very early in the stage, and also avoid the complications that can occur. Okay. So these are the examples of the things that we need to do.
But Prof, we didn't really have that culture of easily just getting up and walking to a health facility to check up. We really wait for something to happen to us before we walk to a health facility.
No, you are exactly right. I mean, and I've heard it said several times in my 60-year public health career that if I feel well and I'm not sick, why should I go to a hospital and clinic? Somebody went as far as to tell me that if you go to a hospital and you're not sick, they can be sure they will find something wrong with you. Okay. But we need to look at the other aspects, that there are a lot of diseases where you have symptoms. You get a cold, you start coughing, or when you get a chest infection, you're coughing. When you get fever, you know you're getting it. But there are a lot of, especially the chronic conditions or the non-communicable diseases, where there are no obvious signs and symptoms. And the only way you can detect them is to have periodic checkups. Your blood pressure is checked, your urine is checked, your body is examined to see whether there are any abnormalities. And most of the non-communicable diseases are very silent until they've got a lot worse before you get the symptoms. So this is what we need to do. But coming back to your question, how can we make it easy for people to access these services? The first thing is to learn more about our bodies, so that we can look for the potential signs and symptoms even before they get worse. If you suddenly starting passing urine several times a day, compared to your previous few months or years, that could be a sign of diabetes. If you've put on a lot of weight and you are getting breathless when walking, it could be a combination of the obesity as well as a heart condition. And the only way you can do is to go to a health facility. Unfortunately, we made it is sometimes difficult for people to go to a physician or a health center. We have to make things so that they improve the situation, so that access to regular checkups is easy, inexpensive, and close to the community. Okay. And once we get that in place, we should be able to detect some of these non-communicable diseases. So that's one. The second is convincing people to go there. Okay. We have to change this mentality that if I feel well, why should I go to? Living in the US, of course, I have all the privileges, and I'm much older than you young people, but there's no harm in doing a health checkup every 6 months or a year. Okay. It shouldn't take too long. It shouldn't be too expensive. A few simple questions and a few check of either your blood or your pressure and all that. And the last point I will mention is that it's even easier now to buy some of this equipment, blood pressure apparatus. Check your blood pressure at home. It takes less than 3 minutes to go through that. Learn how to read them. Even the machine will tell you whether your blood pressure,
Oh,
and they are not expensive.
We'll say that this is, you are going a little bit into the elitist lifestyle, because the ordinary person out there walk into a pharmacy or a health facility to request to purchase a device that will check blood pressure and all. Isn't that asking for too much?
No, actually, it isn't. It's not only are you giving the person the ability to control their own health or disease state, and this puts you in charge. Okay? Why should I walk into a facility for them to tell me that my blood pressure is so high? I should have found a way. If there were symptoms, I would have detected them. But in diseases where there are no symptoms, sometimes years before you have symptoms. This is the best way and the cheapest. And blood pressure apparatus can cost maybe, how many? 300, 400 cedis. I can assure you that's a lot cheaper than when you get your first visit and you have a stroke. That will be end of your career, possibly for some, or at least being handicapped to do your work, income for the family. How do you compare those losses to a 400 CD device that checks your blood pressure every 6 months? So the point is, the cost is, I don't think the cost is prohibitive. I think it's more of the education, and then and you convince somebody that, look, all you have to do is forgo some beer. I'm just joking, of course, but forgo some of the other things that you have to do in order to do something as simple as that. But blood pressure is only one of them. You also have to learn to monitor your own health. Okay, if you have persistent headaches, or symptoms that won't go away, or you are diabetic and you start having sore under your leg, these are things that you should know that as a diabetic, you can't afford to have any of these things. And the moment you have them, you have to seek help and have it taken care of rather than wait. Strokes should not occur or should be very infrequent. There are a lot of people, when I was working as a doctor in either Takrady or Kolebu or Salaga, there were a lot of people where the first diagnosis of hypertension is after a stroke. When that happens, it's much too late. First, there's damage to the brain, and then secondly, there may be paralysis, and so you've lost a chance. And I've seen patients who are 30, 40, most of them obviously older. So when I say that we have to invest in our own health, I'll get an economist to do the calculation between the cost of a blood pressure apparatus, the cost of a few other things that we can do at home, and compare them to the loss when these things actually happen 20 or 30 years from now.
Prof, culturally, from our settings, what can be done?
Culturally, we have to change a lot of old beliefs. Belief that if I feel well, then I'm well. That can apply to infectious diseases. It doesn't apply to non-communicable diseases. Diabetes, cancers, cardiovascular disease, all of them, the diagnosis has to be early. And therefore, people should start taking good care of themselves early and understanding what these diseases mean. That's probably one of the most important things. And we can learn some of it on radio programs, on TV, but the best ones will be community-based programs, where you have people who have the time to explain and understand some of these challenges, and for us to adopt them as part of our normal life.
So therefore, education must be done regularly.
Education should be done not only at all levels. At the community level, if you have to involve the chieftaincies or wherever, other community leaders, for them to be part of this. Then it has to be at the school level. Children should understand some of these things as part of their education. And then by the time they grow up, and then also the workforce and the workplaces should use this as an opportunity to educate their employees. It will eventually benefit them. Right. I mean, if people have to not go to work because they are ill, it's the employer who loses. Right. So it's both at the community level, at the educational level, right. And then some other mass media approaches that right. We can use. And again, this has to be tailored to meet whether it's an urban community right. or a rural community, right. And there have to be variations. And there are people who know more about how to do this at the community level than we do.
Right, right. I want to remind you that you are still watching a very special edition of the Living Well Health Show right here on Metro TV. My guest for today is Professor Peter Lamte. He is a professor in non-communicable diseases, and he is a physician by profession. We are having a very good time knowing that non-communicable diseases are these lifestyle diseases that are just right at our doorsteps. We need to change some mindsets. We need to change some lifestyles, and we need to regularly check our health. We don't wait till something hits us health-wise before we walk to a health facility to try to check what might be causing what. And looking big and looking good doesn't mean always that you are well. It might mean that something is amiss health-wise. We'll go for a quick commercial break. We'll be back and continue this conversation. Welcome back to this very special edition of the Living Well Health Show on Metro TV with me, Sandra Ofosu Dewolu. We have been speaking with a professor in non-communicable diseases, Professor Peter Lamte, and we've had quite a very insightful conversation so far. So we will go back and continue this conversation. Now, I want to find out from Prof, what's the impact of NCDs or non-communicable diseases is on development. We'll start from Ghana and then the continent at large and then on the global level. Prof, welcome back to the Living Well Health Show.
Thanks, I'm delighted to be back.
Thank you. So we want to now find out about the impact of NCDs on development.
The impact is profound in a lot of ways. The first one is that non-communicable disease cause a lot of ill health. Right. People are sick, they cannot go to work, and they sometimes, well, of course, when you get a stroke, for example, right. or you have a heart condition, you cannot work on the individual level, you are unable to work, and therefore your income, we all know that most people in Ghana, once they have an income that is no longer there, right. they have no other alternative, right. okay? So loss of income is one. Right. Secondly, we forget that another important part of it is loss of the individuals or group of individuals to the sector, to the country. Right. So if you have a high prevalence of disease, you're not only affecting a lot of individual families, right. as well as the breadwinner, but you're also affecting the country level. Right. And people that the country has spent a lot of money training right. are dying prematurely or incapacitated to such an extent that they cannot contribute. Right. So the impact, the third element of it is that if governments, actually I'll say even now, the government is spending a lot of money on keeping people who normally should have been well, but are now sick, keeping them alive and keeping them, because the healthcare costs are not only met by the individual, but they also met by the community, by the government, and by other entities. So the public health aspects or the preventive aspects in this regard is profound. Okay, it not only saves an individual family, it not only helps with the next generation, it is affecting the community and the community losses, it's affecting the national level, and therefore trying to address these challenges is for the benefit of all at all the levels that I've mentioned. Okay, so we in the developing countries now have to compete with the economies that are well established. Okay, we cannot afford to lose those. I mean, look at China, look at India, all these countries that have already taken over some of the large industries in the world. They are way ahead of us. China supplies anything from computer chips, the whole range, and they do it extremely well. What does Ghana produce other than producing cocoa? I'm not saying that, I'm not undermining what we're doing, but it's becoming more challenging, and I'm not an economist, because it will become more challenging if we don't address these health issues for Ghana and other countries to be able to move forward and catch up with other industries that exist globally.
Globally, that have already developed. So are there any lessons to be learned from developed countries, what they did in responding to non-communicable diseases?
Oh, I think there are a lot of lessons. They went through the same thing we are going through several decades ago. Okay, and so the lessons are that they actually went. Some of the countries that I'm familiar with improved the situation by improving healthcare delivery. Okay, expensive, but it was done. Okay. We can do the same. We need to do the same thing, but we cannot afford to put all our eggs in one basket, because having the medical response that they have now is a lot more expensive and a lot more challenging. And that's the reason why we talk about doing things at the different levels, at the individual level, the community level, and then have the government contribute to the national level. But we need, and it isn't only the money that has to be put in, it's the idea of the mentality and the behaviors that can only be changed by individuals and communities. The industrialized countries, one advantage they had was rapid education of their population. Okay. We don't have that luxury. We're still advancing rapidly. We're getting more people educated. But there's still a large chunk of the population that is not as well educated as you have in industrialized countries. But we have to move all of them along the chain to be able to, and that's where community initiatives are important. Simply doing preventive measures for urban areas is not good enough. You have to take it to the level of the community and the individual. So that's what I would say, that we can learn a lot of lessons from them, but we also have to apply our better understanding of our communities to be able to catch up before things get out of hand.
Does that answer the responses in the past and what is being done now?
I think some very good attempts have been made, there's no doubt, in trying to control. But unlike a disease like smallpox, or some of the other infectious diseases, where you can have a sizable impact by just immunizing large chunks of people, non-communicable diseases are more complex. You cannot change everything just by having an education program that cuts across. You don't have vaccines to immunize people against the disease. So you have to, there are a lot of things that we have to change that we've already gone through. So it will be more difficult, it will take more time, and it will be more challenging, and it will cost a lot more money. But these are the diseases of the present as well as the future, and we have to live with them. And the only way we live with them is to improve our capacity to address them early and to prevent us spending more money and also putting more people at risk in the future.
So in the era of Sustainable Development Goals, there's a target of 2030 for this second batch of the development goals. And we are already 3 years into the last decade. So we've got just about 7 years to go to attain some of these. The goal 3 says health, good health for all. I mean, what should be some action points that collectively can be done or must be considered, for instance, by governments in power to ensure that we are heading towards 2030, where some of these, for instance, non-communicable diseases would be brought to the barest manageable minimum?
From my perspective, I think these goals obviously are laudable, and we need these economic goals to be able to move forward and compete with the rest of the world. So that goes without saying. But I don't think we'll be successful in achieving them without addressing the health issues that we are talking about. Okay, and again, I've emphasized earlier that compared to infectious diseases, non-communicable diseases are a lot more difficult. Okay, and just like you can do immunization to cover the whole country, and then you get rid of one particular disease, or you can change things drastically without putting a lot of money. These conditions will prevent us from achieving these important goals if we don't address them, or at least reduce the prevalence of these diseases. Again, going back to what I said, and namely, the reason why we have to do this is that these diseases are more expensive to treat than to prevent. Secondly, they will affect the economy. When you have a lot of people who cannot work or cannot produce, whether at the farming level or at the industrial level or the intellectual level. So you can't have these goals without a comparative addressing the challenges that will make it difficult for the economic progress. So I would say that it should be taken as part of that package, because without that, we're not going to get there.
Any risk factors that globally or continentally or even on the national level must be taken into consideration so that we know that these are the factors that we should be watching out for and working towards to eradicate or bring to the barest minimum NCDs?
Yeah, there are some of the things that we've addressed in the other part of the conversation. But as I said earlier, they fall into in my mind, three main groups. Things that you can do at the individual level. Okay, and I will emphasize them again, that NCDs are here to stay. They are part of development, part of our growth as a society, and they will continue to exist. The only thing we can do is to minimize the effects, the bad effects of them. Everybody who is poor in this country wants to live like you. Eventually, they see that as an accomplishment. If they have a car, if they have offices that will work, if they have a nice house. Those are goals but we should make sure that these can be achieved without the other consequences that they lead to because of the new lifestyle that people have to have. Okay, industrialized countries went through that, and they are the first ones to get these challenges, and they've managed to solve most of it, not completely. They're still high level, but we have surpassed them in terms of mortality and morbidity rates. So they've taken care of that, and now they are growing. The economies are growing. We are caught between the pre-industrialization period. We're trying to catch up with the established economies in the world, but we are facing the same problems that they are facing. Okay, and so there has to be a balance between solving Fortunately, we solved a lot of the communicable diseases.
Right.
Okay, not all of them. There's still a challenge in different parts of the country or the continent. But the next stage is to actually have better control of the non-communicable diseases and also address what we call the precursors. What are the conditions that make it difficult for a community to prevent this from happening? We've talked about education, educating people. We're talking about changing behaviors, all those things, having better services.
Right.
Okay, so we have a delicate balance between suppressing or controlling communicable diseases, improving the issues related to non-communicable diseases, and then industrialization and catching up with the rest of the world. And there are countries in Asia that have done this very well. And I believe that we have the capacity to do that, and we have to play our role in terms of addressing diseases that people don't need to have.
We need to play our role in terms of addressing diseases that people don't need to have. Those are words from Professor Peter Lamptey. I mean, these lifestyle diseases can't be prevented. They can't be prevented. And we've learned that
they can be controlled.
And they can be controlled. Let's just say that due to one or two reasons, they can't be prevented. They can't then be controlled. Mm-hmm. So there are a lot of things we've talked about that we need to check on the individual level, on the community level, some mindsets to change in order to help put things in the right perspective. Some diets we need to check. Okay, eating balanced meals in the right proportions and at the right times, and exercising. We must find ways to exercise. We must find ways to exercise. So if you are not in your own vehicle, moving from one point to the other, you are in a public transport sitting in traffic for more than an hour to your destination and an equal time back from wherever you went. And then you get home, there's not much activity, and then you go to bed, and the cycle goes on and on and on. It's about time we change these lifestyle behaviors and help minimize these non-communicable diseases. Prof, some final words. Before you became a professor in non-communicable diseases, you did quite a number of maternal and child-related health. How did the switch come in? What advised the switch?
Yeah, actually, I started in maternal and child health.
Okay.
Yes. And the reason why I got into that field was because at the time, 50 years ago, babies and mothers were the most neglected population in our country. The women were having a lot of babies, having difficult pregnancies. A lot of women died from poor delivery situations.
Right.
And then children of high infant and child mortality, a lot of children were dying. Mm-hmm. So I was attracted to that field because there was so much that needed to be done.
Right.
I got both my degrees from UCLA, a master's, and my doctorate from Harvard in maternal and child health.
Okay.
Okay. And those, we got a lot of experience. We shared a lot of our experience with some of the other, not only teachers, but some of our colleagues from all over the world. We quickly learned how others have managed it.
Okay.
There were incredible programs from China on how they have managed some of these efforts, and they transformed their country overnight.
Right.
Okay,
right.
They have a different political system, but they were able to do it. Mm-hmm. Okay, but they were useful lessons. So that was the reason why I was attracted to maternal and child health. Right. I've already said that to you, that I'm the first of 10 children, so I saw it at home. Fortunately, my parents were a little more affluent, but still having 10 children.
Right.
And all 10 of us lived until over 65.
Wow.
So those are lessons that I've learned. But then I realized that, yes, we have made some progress in maternal and child health, but we are making very little progress in infectious diseases.
Okay.
And during that time, the HIV epidemic hit. And it's still one of the most well-funded programs ever in our history. And I think the figures are close to 200 million people were infected, and a large proportion of people died. But that was also a wake-up call for me that despite the efforts that we're making, when a pandemic hits, it doesn't matter what you have done. This is a completely different type of disease, and HIV was terrible. It spread very quickly. We had no vaccines against it, and treatment. It was a viral infection that was difficult to control. But then we worked at it. Unfortunately, HIV can be treated very well. We still don't have a vaccine, but it's manageable. Okay, and it's come down. The mortality has declined drastically. Most of the HIV is still in Africa, what is left of it. Okay, but then as I evolved in my career, I looked for the next challenge, and the next challenge were people at my age. I started, obviously, started looking at, I started with child, mothers, and then general population. Then I realized that we are also, despite all these epidemics and all the health issues, we are very quickly becoming a pre-industrialized industrialized society. There are a lot more people living, and there are a lot more people getting the diseases of the affluent. Okay. The longer you live, the higher the chances of you getting a non-communicable diseases. So that's how my career has progressed. And over the last 15 to 20 years, I focused on the diseases of people of my age. No, actually, I'm interested in all ages, but these are, and I found out that the diseases, the non-communicable diseases, are the most challenging that I've ever faced. More so than diseases of mothers in childhood, diseases, infectious diseases. This is a long time, and none of us can ever achieve what needs to be done in a lifetime. These are diseases that 100 years from now will still be addressing other aspects of it and other diseases that will are likely to come up. So I'm glad that I can offer some help based on the experiences that we have, and also change them to and adapt them to not only to this country, but other countries in Africa, and make sure that we improve the quality of life for the average African.
And need to improve the quality of life for the average African.
Yes.
Quite deep. A lot has to be done. I mean, on individual country levels, and then continent-wise, is there anything, let's say, the AU can do?
Well, that's above my pay grade. But no, but still, I think there's always something that can be done at the continental level. And this will include political leadership, for leaders in Africa to say, look, we face similar problems, we have similar solutions, we face challenges in terms of industrialization and how we use our funds. So let's learn lessons from other countries that despite these challenges, they've overcome them with the still limited resources that they have. And there are countries that have been very successful, so we can learn from them. Secondly, we can also galvanize those that are at our level and say, we can do better, We can achieve those that have been, have done this the hard way, but we can also take ourselves, because without us succeeding, we'll perpetually live in the shadows of the successful African countries, and more so in the industrialized countries outside of Africa, and we can afford to lose that race.
Thank you, Professor Peter Lamte. We are privileged to have being in your wonderful garden outside of our normal studio to have this conversation. It's been good speaking with you.
Thank you, Sandra. It's a pleasure talking to you. And like you, I also learn as I talk to the media and the questions that you ask and your interest in your interests are the same as ours. Okay, so we work as partners together. And if I may say, my wife will be delighted that you like her garden. Yes.
It's lovely.
Yes.
Tell her garden is lovely.
Oh, yes, yes. Sure, yes, I appreciate that. Okay.
Right. This has been the Living Well Health Show on Metro TV. So, as usual, we have our foodies joint and we have the aerobics. So, foodies joint is by kind courtesy at Lisa Hotel. So, let's see what Chef Daryl Freeman has for us.
Okay, welcome back to another episode of Living Well on Metro TV. My name is Daryl Freeman and I'm the executive chef here at Elisa Hotels in Northridge, Accra. Did you guys make the other salad? I was watching, but I couldn't see many of you making it. So hopefully this week you'll start making this salad. So we're going to make a chickpea and mint salad. So let's get started. Okay, so the first ingredient we need is lovely chickpeas. Now these are low in cholesterol and also help grow your bones a lot stronger. So a very good part of the ingredients that we need. We've got tomatoes. Also another thing, low in cholesterol and provides important vitamins, also needed for your body. And also we've got some lovely lemon juice and lemon zest. This is also very good for taking with your diet. As mentioned last week, we've got some nice feta cheese here, and then also some beetroot. Okay, with beetroot is very good for your blood cells and everything else. We've got some freshly picked mint. Okay, mint is very good for detoxing and also full of vitamins. We have some garlic, okay, freshly garlic here. We have some red onion. As mentioned before, the red onion is a lot sweeter than the white onion, not as harsh. And then also, we've got some lovely cumin powder, which has been ground down, and that also helps your blood flow and everything else. So, we're going to get started. Another thing, as we always do, as mentioned last time, because we're making salads, we have our green board to stop cross-contamination, and also we have our sanitized water with our cloth so we can wipe down. Okay, so let's start cooking. So we've got our big bowl here. Now what we're going to do, we're going to start adding the ingredients in different times. So we've got our lovely chickpeas as mentioned before, so we take a handful, placing them in. And again, as you can see, I'm wearing gloves to help so I'm not got bare contact with the food. We've got lovely cucumber, feta cheese, red onion, and I'm going to keep a little bit as well because I want a little bit for garnish. I'm going to add some of my garlic, parsley. Now you can see all the colours are coming through. I've got my beetroot. Okay, then I'm going to take one of my tomatoes. And take the seeds out. Take the seeds, cut them into little diamond shapes. And we're going to add that to my salad. Take some few little mint leaves. The mint will give it a nice fresh flavour. We've got some of our cumin powder. This will give it another edge of spice. We have our lemon juice. and lemon zest. So we're just going to add a little bit of that in there. This will bring out the sharpness of the salad. And then we've got some olive oil. Now olive oil is very good and better than normal sunflower oil because the sunflower oil is high in cholesterol. So this one here is a lot better. So try, and if you can, is swap your cooking to olive oil. It's a lot better for you, more healthier. Okay, so we've finished that. Now what we need to do is get our bowl, which I'm using a local bowl, and I've got some watcha leaves just to give it a bit of depth. I'm going to take this, give it a nice mix. Okay, then we're going to place it in the middle. And the salad. Okay, then we can sprinkle a bit more of the beetroot on top. I have some roasted sweet potato, which we'll add on. And then also I have some cucumber, which I've very finely julienned down, and I've added in water and put in the fridge so it all curls up. That's a little for the garnish for the top. Some more fresh mint leaves. And a little bit more of the olive oil to give it some shine. And there we go. One very healthy chickpea and mint salad. So there we have it. Again, with this, don't have bread with it, don't have rice with it, don't have anything with it. Have it simply on its own. We're all going to start eating healthy, and this is one way of eating healthy. A nice, fresh salad. As I mentioned before, it's got all what our body needs to refuel, to look after our body, to give us health benefits and everything else. I'm watching you. Till next time.
Okay, so next is the aerobics section from the Alisa Hotel Gym right here at North Ridge in Accra.
Good morning and welcome to Alisa Hotel Gym. I'm your instructor. My name is Richard Labi. Today, this is our machine we're going to use, which is the cross trainer. It's a cardio machine and it's also for the total body workout. I'll be taking you through how we use it. In order not to waste time, we have a quick start on it. So you just hit the quick start and then we go. So let's go. Okay, using the cross trainer, when you start it like this, it's a bit soft. So you have levels on it. You can increase the level. Okay, so now we're going to leave travel on the machine to work out some more. So travel, keep going. The machine has two handles. Travel is holding the moving handle. You can leave this one and then hold the other one too. At this stage, the pressure is on the leg alone. The hand is not moving. This machine is set a way that you can work out with only the lower body, and when you want to add the upper body to it, you hold the handle and then moving it. So keep going. Okay, that is all for our cross trainer machine for today. Remember, it builds a good heart, it helps for your cardio, and gives you a strong body. My name is Richard Labi. Thank you very much for today.
All right, so there you have it. You have to eat healthily. So we've talked a bit, we've dwelled a bit on our meals, what we eat. Now we want to be like developed countries. We are getting ailments that developed countries, the elite have, even though we are still down there at the level of development and also do not have that much money that the elite have, but we are getting their diseases. So we can go back to brodia yatoto, you know, and kontomre, you know, you can do that with your kobe without all the frying and all the oils and all of those. They are nice, but the meals that are not very, very nice, they are the healthier ones. Okay, so just as Chef Daryl Freeman has showed us, you can get some healthy meals to top up our living well, and also we can exercise some more. You don't only have to go to the gym in order to exercise. Let's do some more walking. Okay, let's consciously make time to do some more walking and to get out of the mundane life for a little bit. This has been a special edition of the Living Well Health Show. My special guest has been Professor Peter Lamte. He is a physician by profession, and he is also a professor in non-communicable diseases, and he's been having this very insightful conversation with us. And so this is where we draw the curtain. Thank you so much, Prof. Until we make your way again with another edition of Living Well Health Show on Metro TV,